Hi, my name is Jamie Schatz, and this is my presentation over low-dose CT scans. This is for St. Mary of the Woods College, course NU 528, Clinical Reasoning and Diagnostics. It is the spring semester of 2022, and the instructor is Dr. Jessica Myers. The learning objectives we'll be covering in this presentation for low-dose CT scans are testing and screening modalities, including sensitivity and specificity, normal and abnormal results relating to lung cancer screening, recommendations from professional organizations, the U.S. Preventative Services Task Force, American Lung Association, and also the American College of Radiology, and also case studies meeting the criteria for a low-dose CAT scan and also not meeting the criteria for a low-dose CAT scan. Why lung cancer screening is necessary. The American Lung Association reports that lung cancer is the leading cancer with mortality in both women and men in the United States, and that smoking is the greatest risk for lung cancer. They also share that exposure to radon and air pollution also contribute, as well as environmental exposures, radiation therapy, other race and ethnicities, and family history. Screening of high-risk individuals has the potential to dramatically improve lung cancer survival rates. JAMA also reports that lung cancer was the second most common cancer and the leading cause of cancer-related deaths in both women and men in the United States. Most patients diagnosed with lung cancer presented with distant or metastatic disease, and less than 20% were diagnosed with localized disease. There are 3 categories of people at risk. The categories are low risk, which are individuals age 49 or younger, 19 pack year history of smoking or less, moderate risk, individuals 50 or older, with 20 or more pack year history of smoking, and high risk, which are individuals age 55 to 77, with a 20 to 30 pack year history of smoking, and either has quit smoking in the past 14 years or are currently smoking. Screening recommendation for low risk and moderate risk are not recommended, but screening for high risk individuals is a yearly screening recommendation. Risk identifiers from the previous slide of people that are at risk identify pack years. And pack years are packs per day per year smoked. A pack year is a way of calculating how much a person has smoked in their lifetime. 1 pack year is the equivalent of smoking an average of 20 cigarettes or 1 pack of cigarettes per day for a year. These risks help identify and explain that developing lung cancer is largely driven by age and smoking status, with smoking estimated to account for nearly 90% of all lung cancers. There are 4 different testing or screening modalities: a chest X-ray, which produces images of your heart, lungs, blood vessels, airways, and the bones of your chest and spine. A chest X-ray can also reveal fluid in or around your lungs or air surrounding the lung. A low-dose computed tomography scan, which is a low-dose CAT scan, is a procedure that uses a computer linked to an X-ray machine that gives off a very low dose of radiation to make a series of detailed pictures of areas inside the body. The pictures are taken from different angles and are used to create 3D views of tissues and organs. Next is a magnetic resonance imaging, which is an MRI. That is a medical imaging technique that uses a magnetic field and a computer-generated radio waves to create detailed images of organs and tissues in the body. And lastly, a high-resolution computed tomography screen, or an HRCT. This is a method of examination which is more precise than a chest CT that diagnoses and monitors the disease of the lung tissue and the airways. Modern CT equipment enables a volume HRCT scan covering the whole lung tissue. To further discuss the testing modalities is the sensitivity, which is the probability of positivity with disease present, and the specificity, which is the probability that the test will be negative when the disease is absent. A chest X-ray has a sensitivity of 54% and a specificity of 99%. A low-dose CAT scan has a sensitivity range of 59% to 100% and a specificity range from 26.4% to 99.7%. An MRI has a sensitivity of 76 to 100% and specificity range of 80 to 95%. And lastly, the HRCT has a sensitivity of 95% and a specificity approaching nearly 100%. Of the 4 discussed testing screening modalities, there are normal and abnormal results that can be identified. A normal chest X-ray shows the normal size and shape of the chest wall and main structures within the chest. An abnormal chest X-ray will show abnormal size and shapes of the chest wall and the main structures within the chest. A normal low-dose CAT scan can show nodules or masses under 4 millimeters, which are considered to be normal or negative. Negative indicates a normal low-dose CAT scan. Nodules or masses that are greater than 4 millimeters can be resulted on an abnormal low-dose CAT scan. Abnormalities such as adenopathy or pleural effusions are also classified as positive findings, which positive low-dose CAT scans are abnormal. A normal MRI of the chest gives detailed pictures of structures within the chest cavity, including the mediastinum, chest wall, pleura, heart, and the vessels from almost any angle. An abnormal MRI of the chest gives detailed pictures of abnormalities within all these structures identified within the chest cavity. abnormal masses or tumors, and chest wall tissues. A normal HRCT, or high resonance CAT scan, is a basic lung unit that is regularly visible, is on the HRCT, and the secondary pulmonary lobule, which is surrounded by intralobular septa. The diameter of the secondary pulmonary lobule varies anywhere from 1 to 2.5 centimeters, which is a normal HRCT. An abnormal HRCT helps identify and clarify specific problems, typically featuring the lung paronychia and of the small airways that correlate with obstructive and restrictive pulmonary function tests. These larger dimensions that are found in the HRCT are considered abnormal. This slide, I shared images of normal low-dose CAT scan results and abnormal low-dose CAT scan results. The image on your left is a normal low-dose CAT scan, and the image on your right is an abnormal low-dose CAT scan with an arrow that points to the mass that is found during the low-dose CAT scan. The U.S. Preventative Services Task Force, also listed as USPSTF, identified that adults ages 50 to 80 years old who have a 20-pack year smoking history and currently smoke or have quit within the past 15 years recommend screening of low-dose CT every year. And screening can once be stopped if a person has not smoked for 15 years or who has a health problem that limits life expectancy or the ability to have lung surgery. The American Cancer Society, or ACS, recommend that people 50 to 80 years old and that are in fairly good health that currently smoke or have quit in the past 15 years and have a 20-pack year smoking history have a low-dose CAT scan yearly. The American College of Radiology, ACR, recommend that individuals in the age bracket of 50 to 77 years old have a 20-pack year history of smoking cigarettes. They are currently a smoker or have quit smoking within the last 15 years, have a low-dose CAT scan annually. This table is a recommendation of the 3 professional organizations that we just covered: the U.S. Preventative Services Task Force, the American Cancer Society, and also the American College of Radiology, and their recommendations, which in summary, if you have smoked for more than 20 years and have good health, a low-dose CAT scan is recommended annually. This image summarizes the recommendations from the 3 professional organizations about low-dose CAT scans. The first one about low-dose CAT scans is that detail is key. A low-dose CAT scan provides more detailed imaging than traditional X-rays, detecting even the smallest of abnormalities. Second is safety first. Low-dose CAT scans give off 90% less radiation than a conventional regular CAT scan. And additionally, the exam requires no imaging contrast. So it's helpful with your kidneys also if you have a kidney impairment. Third is the speed. A low-dose CAT scan usually takes less than 10 minutes, and the images are taken during a single breath hold. And fourth is the accuracy. More detailed images mean more accurate diagnoses, and the research shows that low-dose CAT scans save more lives than those at high risk of lung cancer than traditional X-rays. Further information that I have found from the American Lung Association offers an eligibility quiz to see if you qualify for a low-dose CAT scan. I've included the hyperlink below if you would like to take this quiz, or if you know someone who has a long history of smoking and is interested in being screened for lung cancer. There are pitfalls that come along with low-dose CAT scans. One of those can be false positives, and false positives have been defined as any result that leads to additional evaluation, which could be a repeat low-dose CAT scan or an invasive biopsy procedure that does not result in the diagnosis of lung cancer. Also, unnecessary harm. Radiation exposure rarely leads to radiation-induced cancer, but also to just induced stress and anxiety from worry from having to be retested or to have a biopsy that leads to negative results. I've included a case study that meets criteria for a low-dose CAT scan. Jerry is a 62-year-old male that presents to his primary provider with a new persistent cough for the past 6 months that's causing him to be hoarse and then most recently short of breath. Jerry reports that he smokes 1 pack of cigarettes daily and has a past smoking history of 45 years. Jerry and his primary physician discuss the guidelines required for a low-dose CAT scan, and then they also discuss the recognition that Jerry meets the recommendation for lung cancer screening, qualifying him as a high-risk patient. Jerry decides to proceed and schedule a low-dose CAT scan with a physician order. Next, I have a case study that does not meet the criteria for a low-dose CAT scan. Norma is a 35-year-old female who is visiting her primary care provider due to a recent advertisement she's seen on lung cancer screening. Norma reports formerly smoking cigarettes occasionally while in college 16 years ago while drinking with her friends. Norma reports she has not smoked cigarettes since then, and she denies any cough, hoarseness, shortness of breath, or chest pain. As a shared decision process with Norma and her primary care physician, they collectively decide that Norma does not meet the requirement guidelines for a low-dose CAT scan. In summary, overall, a low-dose CAT scan annually is the most recommended screening for lung cancer from the professional recommendations for high-risk patients that can also help reduce lung cancer mortality. All professional recommendations shared the importance of a shared decision-making process between the patient and the physicians. The professional organizations that I discussed once again are the U.S. Preventative Services Task Force, who recommend low-dose CAT scan screening annually for high-risk patients, the American Cancer Society, who recommends low-dose CAT scans annually for high-risk patients, and lastly, the American College of Radiology, who recommends low-dose CAT scans annually for high-risk patients. I've also included a list of all the references I used for my presentation. And lastly, I am including 5 review questions that I have reviewed throughout the presentation, and I hope that you can answer. The first one is, what are the pitfalls that were indicated for low-dose CAT scans? Number 2, how often are low-dose CAT scans recommended for high-risk patients? Number 3, how is PAC year defined? Number 4, name the 4 testing procedures that can be ordered for lung cancer. And lastly, number 5, how are false positive results defined and how might they affect a patient? Thank you for viewing my presentation, and I hope that this has helped for lung cancer screening and low-dose CAT scans.